Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. Segments today. First off, Lottie Moss, the sister of supermodel Kate Moss, overdoses on Ozempic and is in the hospital. What happened? We're going to talk about it. And then, is Gen Z too young to get Botox? We'll think about that. And then finally, marijuana use. Does it have risks with plastic surgery? We're going to tell you all about it, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please smash that like and subscribe button. It helps us so much. Also, big shout out to all those who listen to us on the audio podcast. Welcome. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the amazing Sarah.
Hi.
In the box, we got Travis. How are you, buddy?
I'm good. How about yourself?
Doing good. It's Friday again, and we're here having fun, making podcasts.
Yes.
It's a good day.
Absolutely.
Yeah,
All right.
it's a pretty day outside.
Actually, it's been great. The weather's like getting a little bit cooler, although I heard it's supposed to get hot again next week. But
not hundreds anymore.
not hundreds, yeah.
I think it's supposed to be 100 tomorrow, but like
Shush. Is it?
literally just like 100 degrees. I'll take 100 though.
100's not bad. I hate
Yeah.
that. It's so funny. I guess in August, I can't remember. It was sometime in the middle of August. I walked outside, because I'm in the hospital all day, and it's kind of cold in there. And so
Yeah.
you when you walk out in August in Texas in the summer, it's like you're walking into like a furnace.
Yeah.
Like it's so hot. And I walked outside, and I was like, oh man, it's actually nice today. Like it's a nice day outside. It wasn't like, I didn't feel like it was super hot. And I was like, I wonder where the temperature is. I looked, it was like 94.
Oh my gosh.
And I was like, oh, this feels perfect. When you're used to like 104, like 90, 94 feels.
90 with some shade feels okay.
Oh man, it feels like you're in heaven.
Yeah.
But yeah, the weather's been getting nice. So any big plans? Anybody exciting stuff?
I'm going to medieval times.
Get out! Are you going to medieval times?
Yeah.
Oh my gosh, how fun! I've been before.
That's all I'm doing, I think, this week.
Are you gonna get down there and participate?
No.
Can you
I
do
don't
that?
think
I guess
so.
you can't. They won't let you down there.
I think little kids can do stuff.
Oh.
I guess you can pay to do stuff.
Are you
but-
gonna eat like the turkey leg with your hand? I guess you have to eat with your hands.
Yeah,
though, right?
they don't give you silverware
Oh
except
my
for the
God.
soup.
Although I'm gonna be honest with you, Sarah. Don't take this wrong. I could totally see you. You have no problem doing that. I think
Using my hands to eat?
Yeah.
Yeah.
Yeah, you'd be all over that. A lot of girls would be like, oh, I'm not going to use my hands to eat this greasy chicken or whatever it is.
Nah,
but,
I'm good.
yeah, I feel like you'd be good.
A friend
yeah.
of mine went to medieval times one time with their dad, and their dad fell into the moat. Like when you first walked in.
Was he drunk?
No, I think he just was like really clumsy. But he fell into the moat, and they
Oh my
had to
God.
go home.
They have to go home? What, did they
They
throw him
got
out?
kicked out.
No, he was wet.
Oh.
He didn't want to buy a
You could have bought
cloak.
a suit of armor or
Oh,
something.
probably so. No, probably
Dude,
so.
I thought at first you were
That
telling me
is
he
so
got thrown
wild.
out of medieval times.
No.
How bad do you have to mess up to get tossed out of medieval times?
just
It's
fell
like
into
getting
the
thrown
water.
out of Walmart or something.
Thanks.
It's just hard to do.
Thanks.
Gosh.
You got anything, Travis, this weekend?
So I'm getting people registered to vote. This
Oh, are you?
weekend. Yeah,
Oh,
I
good.
am.
That's always a good thing.
I'll be in Fort Worth helping people register to vote.
All
this
right.
weekend. Yeah.
Excellent work, man.
Yes,
Get out
indeed.
there.
That's
Trying.
cool.
Good job. All right, let's roll into some segments. So, we just, I guess it was a couple weeks ago, did a segment on Ozempic and the GLP-1 agonist, and we were talking about, remember, it was the huge benefits to people who are obese, that they had a much less chance of sudden death if they were taking Ozempic or one of the similar drugs. And even in that episode, I said, man, we're really not seeing any bad
Negative
things happen
things,
with
yeah.
this drug, right? Well, I guess the universe is pulling a fast one on me or trolling me or something, because this week, man, a story popped up about Lottie Moss, who is the sister of supermodel Kate Moss, and she overdosed on Ozempic, ended up in the hospital, had a seizure.
Why is she taking Ozempic, though?
Well, that is a good question that we will definitely talk about. So in this She was on her pod. I guess Lottie Moss. I don't know who Lottie Moss is. Do you guys
Never
ever heard of her?
No.
I mean, I know Kate Moss, but
Yeah.
I guess Lottie Moss is like maybe somewhat known. Maybe I don't know. Travis, Lottie Moss. No.
No, I'm not familiar with Kate Moss either, though.
You don't know who Kate
She's a
Moss
model.
is?
Maybe if I see her, maybe I'll know.
She was
her.
that supermodel from the 90s who weighed like 80 pounds. Like she was like that super. She didn't really weigh 80 pounds, or maybe she probably wasn't too far off. She was like that supermodel that was like super thin,
Okay.
like too thin. Like I was like, things are getting out
Like
of hand here.
skeleton.
Yeah, she was
gosh.
really thin. Anyway, so
Yeah.
so Lottie Moss is her sister, and she's got a podcast. And so on her podcast this week, she was on talking about her Ozempic experience, and man, she was super negative about it,
Yeah.
like really negative. So I got a video. Roll that video. It's about a minute long. So
Really, really big fad that's going on right now is Ozempic, and I'm not gonna lie to you guys, I definitely tried it. When I tell you it was the worst decision I ever made, so if this is a warning to anyone, please, if you're thinking about doing it, do not take it. Like, it's so not worth it. So I took it for 2 weeks, and I've never felt so sick in my life. It's not like you can stop taking it. It's like a pill or something that you just don't take when you wake up in the morning. Like, it's in your system. I felt so sick one day. I'd said to my friend, like, I can't keep any water down. I can't keep any food down, like no liquids, nothing. I need to go to the hospital. Like, I feel really sick. We're waiting in the ER. It's taking forever. We go and see one of the nurses. She sent me to the emergency room. I got wheelchaired through the hospital. At one point, I went to the bathroom, felt really sick, and I felt like I was gonna pass out. And I said to her, like, I feel something's happening, like I don't feel good. As soon as I get into the room where I get seen by another nurse, I literally had a seizure from how dehydrated I was, which honestly was the scariest thing that's ever happened to me in my life.
man, scary stuff, right?
Yeah.
Got to go to the hospital, having a seizure. So so she started taking Ozempic. In 2 weeks, she lost 11% of her body weight. In 2 weeks, like that is an insane amount. And
What was her body weight at the beginning?
yeah,
That's why.
yeah.
That's why she's
Sarah
sick.
like already knows where I'm going with this. Like she's reading my mind. Yep, you're exactly right. So she lost 2 weeks. She lost 11% of her body weight, which was about 14 pounds. She was vomiting continuously. She got severely dehydrated. When you get severely dehydrated, your electrolytes get out of balance, and you can absolutely have a seizure. So, actually pretty dangerous stuff. And of course, she releases this thing, and there's a lot of people on social media saying, "Oh my God, this is so terrible. This drug isn't safe." I mean, what do you guys think?
It's probably because she was not overweight at all, and her doctor gave her the wrong dosage.
Oh, it gets better than that. So first off, let's talk about the indications for Ozempic. I mean,
Yeah.
you're 100% on track here, Sarah. Like you're on the right pathway. So Ozempic for weight loss, recommendation is for BMI of 30 or greater, okay, or a BMI of 27 with at least one weight comorbidity. Now, so for those who aren't familiar with BMI, anything over 30 is considered obese. 25 to 30 is overweight. Normal is considered 18.5 to 25, right? So Lottie Moss's BMI, 21.
Yeah.
Like she's on the lower end of normal.
Yeah.
And you hit the nail on the head. Like, what was the doctor thinking? Well, I got one more video. Roll it up.
I was not feeling happy with my weight. I had a friend and she could get it for me. And it was kind of below board, I'm not going to lie. It was from a doctor, but it wasn't like you go into the doctor's office and he gives it to you, prescribes it to you, he takes your blood pressure, and he takes all of these tests, which is what you need if you're going to go on something like Ozempic. The amount that I was taking was actually meant for people who are 100 kilos and over, and I'm in the 50s range. But anyway, I took it. My friend had got it for me.
Yeah.
Stupid.
Now what do you think?
She must have been.
I don't know.
Oh my gosh.
I don't know what to say.
That's really sad.
Yeah, if you take medications, that I mean, this is a great example of how even benign medications can be dangerous if you don't take them properly. I mean, I consider Ozempic fairly benign. I mean, obviously, and she's an example of you can have some really bad side effects that can be dangerous, and that goes with every medication.
Yeah.
Even things like Tylenol.
It's almost like she was treating it like she was just like gonna pop a diet pill or something. You
Yeah.
know, when diet pills used to be like really popular.
Oh yeah, I mean they're still out there, but yeah. I mean, I don't. I'm kind of like, I'm not like mad, but like I feel a little. What's the right word? Just like upset that she's out there like bad mouthing these GLP-1 agonists, that they're so dangerous, when she basically just got like off the street,
Yeah.
and didn't consult anybody on how to properly
Yeah.
take it.
But maybe it's good that she's talking about it. Like, don't do what I did.
Yeah,
kind of situation.
yeah, that's actually a really good point. Well, except that's not how she really phrased it when.
I know.
I
but
watched her.
She just wants the.
Well,
the-
I will say now
people
we're
to
talking
view
about
it,
Lottie
yeah.
Moss, who none of us even knew who she was,
Yeah,
and I actually
that's
watched
what
some of
she
her
wanted.
podcasts.
Yeah.
I know, right? It's like maybe I should go do something really dumb, and then more people will watch me. I
Yeah,
don't
just
know.
name our shows like absolutely like not what it's really about.
Yeah, right. So yeah, if you take double the dose of something, it's going to have bad effects. And so she took double the dose. Her stomach basically quit working. She wasn't passing anything, and then she just starts throwing up and gets really dehydrated and ends up having a seizure. I mean, none of this is unexpected, really.
Yeah.
Yeah, I hope that, and I don't think it will. I mean, I think I think that most people realize if you take a drug without a doctor's direction, that you can't
Not
really
the
blame.
best.
it's
You're not going to have the greatest.
You're not gonna have a great outcome. And
yeah.
you shouldn't blame the medication for that.
Yeah.
I mean, we have a lot of people that are taking semaglutide, and I don't think we've had anybody quit taking it. I mean, people will say, yeah, you have side effects at first, but generally they pass and they're not bad. But also we're careful about prescribing it. And it also brings up the question of, why is a girl with a BMI of 21 taking Ozempic?
Yeah.
I mean, I've had people say to me, I think I'm going to take Ozempic, that were clearly, not really needing Ozempic.
Yeah.
And I talked to them. I was like, look, you don't need to do that. Like you're either, if you want to lose some weight, that's fine. But I mean, this is like overkill.
Yeah.
Like this-
Dangerous.
yeah, I mean, well, the danger is, I mean, I think she could have safely taken it, but you can't take a dose for an obese person that weighs 250 pounds if you weigh 130 pounds.
Yeah.
That was what she weighed, by the way. Did I tell you?
She said 100. You didn't say it, but she said 100 kilos. I have no idea what that means.
Well, she was taking a dose 400 kilos,
Yeah.
so that's
And she
220.
said she was
and she weighs
50
like 50 something kilos. So 50 something would be like between 120 and 130 pounds.
Yeah.
But she's tall. She's 5'6".
Yeah, so she doesn't need to be taking it.
No,
at all.
she doesn't need to be taking Ozempic. So, and I guess it's kind of sad that she felt like she needed to take Ozempic. I mean, that's another thing you could talk about in this story is like, what kind of pressure is she under that she feels like she has a BMI of 21 and she's too heavy? I mean,
Yeah, well, I guess it's just the environment she's in.
yeah, she's
Hollywood.
kind of
thing.
I don't know if she's famous or not. I mean, people.
Well, her
some people-
sister is, so
Yeah.
she's around all those.
Yeah,
all
that's
those
true.
people
Yeah,
that
and
are,
plus her sister was a supermodel, so
yeah, who was famous for being like
for being thin. Yeah.
really, really thin. Yeah.
So, well, interesting story. All right, well, let's recap this one. So, today we were talking about Lottie Moss, the sister of supermodel Kate Moss, who went on her podcast talking really badly about Ozempic because she overdosed on it, ended up in the hospital, had a seizure. And so it's kind of scary stuff because there are now over 40 million people taking Ozempic. Well, when you dig into the story, come to find out, Lottie Moss got the Ozempic from a friend, didn't go see a doctor, and she was taking a dose for somebody that weighed 220 pounds when she weighed about 120 pounds. So, probably taking double the dosage, which any medication, even something that's benign, can be dangerous if you take really high doses of it. So, I think the take home from this is if you're going to take a medication, it's obviously best to consult with a physician to make sure that you're not taking an amount that might be unsafe or might give you unwanted side effects. So, good
Yeah.
story. All right, moving on.
That
We
was
t-
crazy.
I feel like we talk about Gen Z a lot. Why do they always pop in? They must be very like,
They're taking over.
they must be taken. Are they taken over?
I don't know. What age bracket is that?
Yeah,
I
it's a
always
great question.
forget.
Gen Z is born between 1997 and 2012, which makes them 12 to 27 years old. Both my kids are Gen Z. Yeah,
Okay.
yours is Gen Alpha. Yeah, because she's Danica is like the very
2015.
yeah.
is when I
Danica is the
was
very tail end of Gen Z. So we've talked about Gen Z in the past, and one of the things we talked about is how they embrace plastic surgery. And so the topic we're going to talk about today is Gen Z too young for Botox. And the reason we're talking
Is this an AI image?
I knew you would figure it out.
Is it?
Yeah, it is.
Okay.
So actually, I made this one.
Why
with,
are they in a field?
I don't know.
I ain't gonna lie. Okay, so I couldn't
Sounds
tell
like
at
a-
first, but the person in the middle, like the kid in the very middle,
Yeah.
their eyes are wow.
I know. I zoomed in and I noticed that too, Travis, because like I have to zoom in to like do the lettering for the graphics, and I was like,
Yeah.
"What's up with this kid's eyes?"
The one in the back, the boy.
It's a pretty good image, though, right?
It looks like it's like a commercial for like Abercrombie or like Tommy Hilfiger or something.
It looks like Gen Zers, though, doesn't it?
Yeah.
So I made this one with Grok. I've been using Grok a little bit more. That's the AI associated with X or
Yeah.
Twitter, and it's actually better in making pictures than ChatGPT. If anybody's
Right on.
interested in AI, yeah. So AI picture, yeah. I was wondering. I was going to try and slip that one under the radar for you guys. All right.
Always.
So the reason we're talking about Gen Zs and Botox is there was actually an article released just recently, this past week, and I think I have a picture of it. Travis, throw it up there in case anybody wants to check it out. Yeah, it's USA Today. Gen Z's overdoing Botox, making them look old. When's the right time to get it? Well, luckily, I am here to tell you. In fact, actually, I've done 3 media interviews
About Botox?
about this exact topic. One of them was local. I always like to do local stuff. One was WRLD, is that right?
Is it radio?
Yeah, it was a radio one.
Is it KRLD?
KRLD, sorry.
Yeah,
Yeah, W is
KRLD.
on the East Coast. Yeah, sorry. KRLD. Yeah, I did a TV one this morning with New York, which was kind of cool, and I got one more next week. Anyway,
That's fun.
I digress. So Gen Zs, born 1997 to 2012, that makes them 12 to 27 years old. And as we said, they really have embraced kind of plastic surgery and cosmetic procedures.
Well, that's like the whole, they grew up watching like, I mean, I grew up watching the Kardashians too, but like
yeah.
getting like the fillers in their lips and stuff.
Yeah.
And
So-
all of that's like goes along with the Botox and just-
Exactly right.
and,
You're
like,
100%
the
correct.
hyperfixation on like skincare products.
Yes. Yep.
Like
and
Avery's already doing that crap.
Danica is too. Well,
But-
Avery's even younger than Danica.
Yeah, she's like, oh, I gotta get. She gets like in a habit of it for like a couple of days, and then she
Then
forgets
she
all
forgets,
about
yeah.
it. But
well, actually,
it's still,
that's
like, a
part of what
thing.
I'm going to talk about as well. Yeah, we talked about how Gen Z is doing plastic surgery and especially minimally invasive cosmetic procedures at a much higher rate than previous generations. And why is that? Social media. It's 100%.
Yeah.
It's not 100% social media, but that is the biggest part of it. Gen Z is the first generation that grew up entirely with social media. Like millennials got a little bit of it.
Yeah.
But social media has been around as long as Gen Zs have really been, aware basically, because, wasn't social media start like, it was about 20 years ago with Facebook,
Yeah.
and so that the Gen Zers would have been like 7, right? So that's all they know is social media. And you get all these influencers on social media talking about getting these procedures. There's that push to look your best for social media, like the Zoom effect where people are working from home and they're seeing themselves on camera. And so it's not surprising at all that Gen Z...
and all those filters.
Yeah, all the
that-
filters. Yeah,
on
exactly right.
Instagram.
It's not hard to figure out why Gen Zers have embraced these things. And so, this article popped up about Gen Zs overdoing Botox and are they too young? And I think the short answer to this is yes. We've talked about Botox in the past in a couple different segments. Botox is a muscle paralytic. You like Botox, right? You like yours, yeah. It's a muscle paralytic.
Yeah.
It paralyzes the muscles that cause wrinkles to form on your face. So when I lift my eyebrows and I get these wrinkles here, yeah, you can barely see them. I'm pretty good. I don't have a lot of wrinkles for my age. Smile lines, which I don't really have that either. And the last one is these frowny lines, which I'm kind of genetically lucky. I just don't have a lot of wrinkles. But at my age, most people would. And so Botox paralyzes these muscles, which prevent those wrinkles from forming. But what it also does is it's preventative.
Yeah.
Because as you age, these lines become permanent. They start to get etched into your skin.
Right.
And so if you start taking Botox when you're young and you don't allow your muscles to make those repetitive motions, then you will never get them. And I always use my wife as an example. She's been using Botox now for almost 20 years, and so that means she started, late 20s, around 30, and she looks freakishly young. She has no wrinkles, and she doesn't look her age. And it's not because she's had a lot of procedures done. Like she uses Botox, and it's just gone a long way to preventing those. And so there is some preventative benefit to Botox, but I just think that Gen Z is just not quite there. Maybe the oldest Gen Z, 27, I could buy a 27-year-old doing Botox if they maybe genetically were more prone to have
Yeah,
wrinkles.
I was about to say.
Yeah.
I'm like, some people just have
They do.
their skin just ages
Yeah.
faster.
I think that the broad-based answer to this question is yes, they're too young, but maybe the very oldest
There's always
ones.
special
Yeah, like a few of the
circumstances,
very
yeah.
of the very.
Like, I don't
oldest
think an 18-year-old should be getting.
No, I think
Botox.
that, if you're younger than 25, absolutely no. As you get in your late 20s, maybe. I think 30 is kind of like the sweet spot for where you start. Because it is best if you start Botox before the wrinkles actually form. Now, that doesn't mean that you don't get any effect if they already have, because I have 60-year-olds that come in, they're like, oh, I think it's about time to start the Botox. And I'm like, yeah, might
You
not.
should have done that. What?
I mean, I don't say that, but you're right. Like, they would have had a better effect had they started earlier. So I guess the next question, is it harmful to do this if you're 20?
I don't think it would be harmful. I think it would just be harmful for them, like, internally,
Yeah,
mentally.
that's perfect. That's a perfect answer. I would agree with you that, there's no, like, medical risk of doing Botox too early. We've talked about the safety profile for Botox. Even though it is a very potent neurotoxin, the safety profile is almost pristine.
Yeah.
Outside of those, remember the fake tox, the Photox?
Yes.
Where that was actually causing problems. But the good Botox, like the real stuff, is very, very safe. One of the things that article mentioned in the title is it's making them look old. Didn't it say that, Charles? It makes them look old? Did I imagine
Yeah.
that article? Yeah.
Yeah, no, I think you're right.
Yeah, it makes them look old. Yeah.
Yeah.
So I think that is a misstatement. The only way Botox is going to make someone look artificially old is if they got really way too much Botox where they couldn't move their face at all, because sometimes people associate that with older people.
Yeah, their eyebrows are too arched.
Yeah.
Situation.
I think for the most part, if Botox is done right, most people won't know you've had it.
Yeah.
I mean, you're just going to look refreshed. You're going to look good. So I think that where Gen Zs, and I've talked about this before, I can't remember if we talked about it on the show or if it's a media interview or what, where I think Gen Zers or young people get looking too old is the fillers.
The fillers, and then
Yeah.
whenever they do that buccal fat removal
Oh,
thing,
buccal fat removal?
Yeah.
Yeah, that's very bad. Yeah, that's right. See, you look how smart.
they look hollowed out.
When people get their lips really blown up, or if they get a ton of filler in their cheek, it just gives them that look of somebody who's trying to not look old.
Yeah.
And so,
It's not like they really do look old. It's just that
yeah, it's
they-
like that they went too far.
Yeah.
We've said this a million times that the best non-invasive or even surgery is the one that no one knows you had.
Yeah.
If somebody can pick out that you've had a procedure, then to me that's
What's
not
the
a
point? Why did you pay all that money?
It's not a good procedure, yeah. I mean, some people do like the artificial look. I mean, I see that a lot with people wanting breast augmentations. I'm like, look, this is gonna make you look not,
Like, people are gonna know.
people are gonna know, and they're like, that's what I want. And I'm like, hey, cool. But I think with the face that, I just don't like that personally when someone looks so artificial. And I really do try to talk people out of that. If they want too much lip filler, because lip filler can be done great. I mean, it's been forever, but I posted a few Instagram pics of people that I did lip filler on, and it's like, man, their lips look solid.
Yeah.
Like, they don't look fake. They just look great.
You got
Like,
some solid lips.
I mean, solid, good. They just
Yeah, I
they
know.
look like a supermodel lip or something, but not like too big. You know what I mean?
Yeah.
So yeah, I mean, you can definitely do this stuff and have it look good. But should they be using filler? Well, I mean, there are fillers, and we've been kind of dancing around this part. There are fillers that you use not to look younger, but you use to change your appearance a little bit. Like, I don't have a problem with like an early 20-year-old getting a little lip filler. If it's done right, it could look awesome.
It's like the whole part of like being young is like there's certain features of your face that when you get older they are more noticeable, like higher cheek, like your cheekbones start sticking out more, like your face isn't.
Like hollows out. It starts
Yeah,
to fall,
and so
yeah.
like whenever you get fillers in your face right there, I would think that would make you look older when you're not, because when you're 18 years old, your face is still like, you might still have a little like a baby face.
Yeah.
Your face is still a little bit younger. than
You
that
know,
age.
I mean, I totally get what you're saying. I generally associate like high cheekbones with youthfulness.
Really?
Yeah, because what happens, Sarah, is like as we age, you know, get into our 50s and 60s, our mid face starts to hollow a bit. Like it just what happens, and so that's why like Voluma, which is the cheek filler, is really popular with like middle-aged women, like 40 plus.
Yeah.
Because it is common for the mid face to start to hollow out a bit.
Yeah.
And so it also helps plump it up, which helps like mask the fall a little bit.
That makes sense.
But if you overdo it and you get these really big cheeks, it's funny, like, you know, my wife and I watch TV, we'll see someone like, oh, too much cheek filler. Yeah, we can just like pick it out where it just
and then
looks
I
unnatural.
feel like I feel like if the filler's too much, then it makes them look like they do have like that buccal or buccal
fat removal, yeah.
because it like makes
Yeah.
their
Yeah, we've talked about that where we've looked at someone as like, is that buccal fat removal or
Or-
is that too much cheek
yeah.
filler? But
That's
see,
what
you
I'm
shouldn't be
saying.
talking about that, right? If
Yeah.
you're picking those things out, like you've gone too far.
Yeah.
And it definitely can make you look older. You know, and the last thing I want to mention about this is what you were talking about with Avery is, you know, if you're in your early 20s, late teens, so like for Gen Zers, and you want to do something to stay youthful, skincare
Yeah.
regimens are actually really good.
sunscreen.
Yes, perfect. So the 3 pillars of good skincare are a good cleanser, a good moisturizer, and sunscreen.
Yeah.
You know, you have no idea how far that will go to keep your skin
I think
looking
we have an
young.
episode that I did about how to clean your face.
You did one?
Uh-huh.
Oh, yeah, we've done some episodes.
one.
You start to forget. We
Yeah.
did one. I don't know if you were here that day. It may have been Danica. I think it was maybe when you were out of town. We did one on skincare for teens.
Yeah.
Because, like, you know, like I said, Danica's already got a skincare routine. And I don't think that that's going too far. But, you know, when you're talking about teens especially, you just need to keep it simple.
Yeah.
Like, you don't have to do all the crazy stuff that a lot of adults need to do because they're correcting things.
Yeah.
You're only doing preventative. So it's cleanser, moisturizer.
Yeah, I think mine was talking about retinol use too.
Oh, retinol, right.
Yeah.
Yeah.
When should people start using retinol? I forget. I think I talked about it.
Definitely not like in your teens
No.
or early years. Retinol is really more corrective.
Yeah.
So, you know, that wouldn't be something that necessarily teens would
Yeah.
want to take.
No.
So,
But,
But,
like after 18. But that generation that you're talking about that wants to keep getting, like, are they too young to get Botox? Like maybe retinol is more of
yeah, maybe like
their
later.
first step
Yeah.
instead of
Yeah,
getting
a little bit.
Botox.
Yes, I'd say that that's probably true. Just really depends on, you know, I mean, they're kind of treating different things, so it just depends on what they're trying to
Yeah.
do, you know. But yeah, I mean, a lot of people ask me, like, what's the best age to start Botox? Well, I mean, it kind of depends person to person, right? Because you got people like me who, you know, I'm pushing 50 and I don't really have a lot of wrinkles.
Because you be getting that laser on your face.
That does help. It's the one thing I
Don't,
do.
yeah,
That's the
it's
one
not
thing I
all
do. I love that
genetics.
laser,
You get
man. I do that every year.
lasers on your face.
But even before that, like I was hanging in there, you know,
Yeah.
and so I'm like kind of, you know, just genetically, I got the good genetics for that. I didn't get the height, but I got the no wrinkles. So, but then there are other people who, I mean, I remember even in high school, I had a friend, and like he already had like smile lines, and he was 18.
Yeah.
Which that's crazy young to have that, but you know, guy spent his summers outside in the sun for years and years, and he just genetically had strong muscles at the side of his eyes, and he already had wrinkles.
Right.
So, you know, I think the generic answer is, you know, probably about 30, but there are exceptions.
Yeah.
I think so. Cindy Hermann chimed in. She said 35, and I love it. Botox is at the top of my list of favorite things for the last 15 years.
It's been 15, yeah.
About 15.
She's
Yeah.
like, no, 15.
I
not
can't remember.
20.
I couldn't remember when she started. But so, all right, let's recap this segment real quick. In this segment, we were talking about, is Gen Z too young for Botox? So Gen Zers are aged 12 to 27. There was an article in USA Today saying that Gen Zers are overdoing Botox and it's making them look old. Is that true? Well, yeah, Gen Z has embraced plastic surgery. They have embraced minimally invasive procedures, including Botox, and is, you know, 20 too young for Botox. In general, I would agree with that. I think kind of the sweet spot starting age for Botox is around 30. Botox is preventative. It will prevent you from developing wrinkles if you start using it before they actually form, so that's a good thing. But yeah, 20 is just a little bit too young. And is it making them look too old? I don't necessarily agree with that part of what USA Today said. It's mostly fillers. When people get fillers that are too much at a young age, it does make them look older. So yeah, so Gen Z, too young for Botox. I think for the most part, the answer to that's yes.
Yeah.
Yep.
Agreed.
All right, last segment.
What do we got?
This one's an interesting one. And this one kind of came to
I'm
me
like,
just,
who died?
Huh?
I said, who died? I'm just joking.
Nobody died. This one kind of came to me just, and this is how I get a lot of segments is, when I'm doing consults and people say something, I'm like, that's a good question or a good potential
Yeah.
topic. So this is marijuana use and risks for having plastic surgery, meaning is it risky if you smoke marijuana and you go and you have surgery? And, I think that most people...
Never had that thought.
Really?
Before. No.
People ask me all the time so let me tell you why. Especially in the world of plastic surgery, if you smoke cigarettes, it is extremely harmful to your potential outcome.
Okay.
And not for the reason that you might think. Most people think, oh, if I'm smoking cigarettes, then the anesthesia is going to give me pneumonia or something like
Right.
that because my lungs are messed up. It's not that in plastic surgery that we're as concerned about. Yes, that is a concern. If you're a 3-pack-a-day smoker for 40 years and you go under anesthesia for 8 hours, you're probably not going to do great.
Yeah.
But where us as plastic surgeons, or we as plastic surgeons, where we as plastic surgeons care about smoking is the nicotine's effect on small blood vessels. Nicotine is a
Okay.
potent vasoconstrictor. If you take your blood pressure and then you smoke a cigarette and you take your blood pressure again, your blood pressure is going to be much higher.
Right.
Why? Because nicotine constricts your blood vessels. And why is that harmful in the world of plastic surgery? Well, a lot of the surgeries that we do rely on small blood vessels to heal the surgery, meaning when we do a tummy tuck, we're dissecting a lot of tissue, which makes the blood flow weaker, and we're relying on the small blood vessels to keep everything healthy, keep everything alive, and allow
Yeah,
it to heal.
that makes total sense.
Same thing with
Yeah.
a facelift, same thing with a breast lift. And so one of the very first questions that I ask all my patients when they come in is, do you smoke cigarettes? And I'll clarify is, or use nicotine products like vape or whatever. And a lot of people say no, but I smoke marijuana. And I'm like, okay, so that's the question. Is that a problem, right?
Yeah.
So that's what we're going to talk about. The bad things, smoking, heart disease, reactive airway, lung disease, all that, but we said most important, vasoconstriction. So now with marijuana, I found this hard to believe, but it's estimated that about 60 million Americans either habitually or occasionally use marijuana, which now is higher than smoking, higher than cigarettes.
Oh.
Isn't that wild?
It's better for you, I guess.
It is. I do agree with that. But I guess it makes sense, right? It's now legal in so many states. It's not legal here in the state of Texas, but in a lot of states it's legal. And, the rate of use has gone up, and now it's actually higher than nicotine products. So is it a big risk if you're having plastic surgery? Well, so short answer, if somebody tells me that they smoke pot, I'm like, it's not a big deal.
Yeah.
I'm not worried about that. Now, there's
You're
a
like,
little
good
bit.
for you.
Huh?
You're like, good for you.
Yeah, it's like, okay, segment's over. No, there's a little bit more to it though. For me, I haven't seen any problems with it, but there are some downsides to it if you are having surgery. There was a study in JAMA Surgery, so Journal of the American Medical Association in 2023, that showed that people that had cannabis use disorder, so basically cannabis, I guess that's like alcoholism for weed.
I didn't think you could get addicted.
Is that like a pothead? I guess it'd be pothead, right? Cannabis use disorder? I'd never heard that term before. I was like, cannabis use, does that just mean they smoke a lot of pot? So people that have cannabis use disorder, which I guess is like 20% of people that use marijuana, they do have increased risk of serious complications from surgery, including respiratory issues, upper airway issues, risk of arrhythmias, and also issues with pain control, which kind of makes sense. If you're smoking anything, it's not great for your lungs.
Right.
I'm gonna ask you guys, and maybe I'm wrong about this. I always felt like if people smoke pot, they're smoking a lot less than cigarettes, right? Like no one's smoking 20 joints a day,
Yeah, I don't.
right?
Think, I don't think you would be
maybe
able.
Snoop Dogg or like, or Willie Nelson maybe, but I think the
I
average
think
person
you'd
probably
be
is.
not functioning.
Yeah, right. So I can believe that if you have a cannabis use disorder and you're waking up at 8 a.m. to fire one up, that probably your lungs are going to take a hit, right? And so yeah, that becomes more important. But to counter that, there was another recent study by PRS, so that's plastic and reconstructive surgery, which actually came out this month, that showed that marijuana users had no increase in complications with
Okay.
plastic surgery.
Yeah,
Like they didn't find any.
that's cool. But I feel like if you're like the cannabis whatever
Use
you,
disorder. I think it's called. We always call those people pie. Like what do you?
I feel like-
Travis, what do you call somebody who smokes pot all day?
a pothead.
A happy person.
Pothead,
Yeah,
right?
that's what I'm saying. Like they're smoking pot all day. They don't probably care about Botox.
It's like
They don't
like
care what they look like.
people who drink all day is alcoholics. Like I didn't know. Like what's the
a
correct term for
potaholic, marijuana.
I guess-
Nah, I think you're right. I think it's probably like a pothead.
pothead, right?
Yeah.
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 That's what we always. You've
But
heard that
if
term,
you're-
right?
Yes,
Okay.
Dr. Bruce. I'm saying though, like if there's a person that wants Botox that just is a pothead, I don't think they exist, because it's like, why do they care?
Yeah, true. That's so right. I bet people with cannabis use disorder probably don't
Like
get a lot
why
of plastic
they don't?
surgery.
They probably don't care what they look like.
Or depending on how like the cannabis affects you, you could care like too much.
Oh,
you
like they're
start-
paranoid.
you get,
They're
like, you
paranoid
get
about
anxiety
their face.
about.
Yeah, you get super anxiety, super anxious about it.
I think I look fat. Like,
need
what's
to
wrong
go
with me? I
right
think we get
now.
lipo like, right now. I'm gonna rush out.
Instead of paranoid about the cops coming after you, they're
Yeah,
paranoid
right.
about their body.
But no, honestly, this is a great topic. I'm surprised we haven't done this one before because there are a lot of people that smoke marijuana because it's legal, and so there's like the stigma's gone from it,
Sure.
and like I said, when people come into my office and they say, I smoke pot, I'm like, oh, don't worry about it. Like it's not. I mean, that's probably a bad thing to say as a doctor, but I mean, I'm just being real with them
You're like,
that.
cool.
Huh?
You're like, cool.
It's like cool. No, we're cool, bro. No, I think that there is a little bit more to it, right? Because people can get cannabis use disorder. That's
Yeah.
my new favorite word. Cannabis use disorder, and that potentially is problematic not only for surgery but other issues. But if somebody's like blazing one up on the weekends, like I'm just like, yeah, it's not going to be a problem. Like
Yeah.
you're fine. I wouldn't like smoke it before you came into the surgery center. They probably would turn you away.
They're like,
We've had people.
I needed to calm down.
Yeah,
I was
we've had
nervous.
people show up. I had one patient one time show up drunk, and they canceled the surgery. Like,
Because they were just like, why would you get drunk before getting plastic surgery?
I have no idea. Like, I'm not sure.
That is so silly.
Yeah, I'm not sure. But yeah, they showed up, and you can't consent, right? If you're inebriated, you can't legally consent, so we have to cancel the surgery. So that was a long time ago.
That's tough.
Yeah, that's crazy, right? So, all right. Anything else to add about
Pot?
cannabis use disorder?
No, not today.
Not today? All right.
Not from me.
Okay, I think that about wraps up our show for today. Thank you guys so much for tuning in. We really do appreciate it. Please leave us a comment. If you have anything that you want us to talk about it, we will have a segment on it, Nip Talk, next week.
Bye.
Bye.